Oh, and here we are, and we're here with Stephen Hopkins. Good morning.
Hi, good morning.
You're with the MotheLode Vein Institute.
I am.
Great, and welcome to AM Live. Here to talk about a free screening event for varicose veins that you're going to be holding here at the Melon Phase Banquet Hall.
That's right.
Okay.
We're going to hold a free vein screening event, and essentially it's for me to teach folks about what we call venous reflux disease. People need to know, they don't need to suffer from their legs with regards to symptoms of aching and pain and heaviness and itching and burning, sometimes swelling. Ultimately, it results in, varicose veins as well sometimes. And I just want folks to know that, now we have a facility here in Jackson, the MotheLode Vein Institute, where all this can be evaluated, treated right here in our office.
Great. And, maybe you can tell us the date of the event.
It's going to be Saturday on the 15th at Melon Phase Diner at noon, and they just call our number 256-9499 and just make an appointment. And basically, I'll be giving a lecture, kind of talking about venous reflux disease, varicose veins, and then after the lecture, we'll have individual consultations. I'll just spend a few minutes with each individual patient. Wear your shorts because I'll need to look at your legs, and then there's free lunch provided, and then I can give each individual patient, an idea of what potentially should be done from then on.
Great, and I believe we have a clip we're going to show. Tommy, take that away.
At the MotheLode Vein Institute, we would like our patients to understand that they do not need to suffer from symptoms or the appearance of varicose veins. We use minimally invasive treatment options to treat these conditions, both in our Jackson and Sonora offices. This is an example of fairly significant varicose veins, which are frequently associated with symptoms of aching, pain, heaviness, and swelling of the legs. We have both superficial and deep veins in our legs. Superficial veins are more commonly diseased than deep veins, and these are the ones that we usually are able to treat. Varicose veins and symptoms from varicose veins occur because of a disease called venous reflux disease. This is most easily diagnosed with ultrasound, in addition to taking a good history and doing a physical examination. Ultrasound has really revolutionized the diagnosis of venous reflux disease. Here's an example of venous reflux disease on the right when the valves in the veins are not working properly. This occurs because of genetics, prolonged standing, and other factors. In the past, venous reflux disease and varicose veins were treated using what was called vein stripping. This procedure is no longer performed and has been replaced by the endovenous ablation procedure. This procedure entails using an ultrasound to place a catheter into the vein and closing off the vein using radiofrequency energy or laser energy. This can be all done in the office using what we call tumescent anesthesia, and no hospitalization or general anesthesia is needed. Radiofrequency energy is used to seal the vein shut so that it no longer carries blood in the reverse direction, which is what causes the symptoms of venous reflux disease as well as the varicose veins, as shown here. This procedure has really revolutionized modern treatment of venous reflux disease and varicose veins. Here's a typical picture before and after treatment with radiofrequency ablation. The MotheLode Vein Institute also uses sclerotherapy to treat veins as depicted here. This technique is usually beneficial for the smaller reticular or spider veins. The MotheLode Vein Institute will be providing a free vein screening event hosted at Mel and Phase Diner on September 15th. Please call the office for an appointment. Free individual consultations will be provided after the seminar.
And we're back in the studio with Dr. Stephen Hopkins. Looks like modern technology has come a long way.
Has come to the MotheLode, that's right.
Exactly. Yeah. And you were saying this is actually, there's not really any pain associated with this procedure.
You know, I can't say there's no pain, but there's very minimal pain. We do all the procedures using tumescent anesthesia.
Okay. And right there in your office, covered by insurance?
Typically, these procedures are covered by insurance, which is because it's a real medical condition. You know, we have to have certain criteria. The ultrasound has to show actual venous reflux and these sorts of things. But because it's a real medical disease, it's typically covered by insurance, including Medicare, Medi-Cal, private insurance.
Okay, and let's go over the date and the time again of your...
So the screening event is going to be at noon at Mel and Faye's Diner. It's on September 15th, and you just call 256-9499 for an appointment, and then we'll get you scheduled, so don't miss it.
Okay. You want also
wear your shorts.
Right, wear your shorts. And that's kind of the benefit to this. You think a lot of people wear pants because of the veins, and they don't want to expose their legs, but with this, it's like a whole new you.
Absolutely.
Okay, tell us about sclerotherapy.
So sclerotherapy is a cosmetic procedure we use to, you know, after all the symptoms have been treated, or if there are no symptoms, we can significantly improve the cosmetic treatment as well. And basically we inject the little veins with a sclerosing agent, and it destroys the vein from inside out and makes the legs look much better. So that's what I alluded to a little bit in my video, and I have a couple of sclerotherapy nurses that do those sclerotherapy treatments, and that's very effective as well.
Great. Well, it sounds like a great thing to attend if you're looking to go. Dr. Stephen Hopkins here with the MotheLode Vein Institute, and thanks for coming on AM Live.
Thank you very much.
Okay, and we are going to run to an ad break. We'll be back after this.
You're watching Amador County's local television network, TSP.